The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Welcome to the first session of our Bloomberg Initiative for Global Road Safety and IndiaRAP webinar series, World Bank and iRAP, Helping Save Lives in Indian Roads. Our topic today is the introduction to BIGRS and iRAP. Thanks for joining us in this webinar series. We've had almost 700 registrations from around 30 different countries. So it's very good to have you here today. My name is Alessandra Fransoia. I am the Training and Accreditation Coordinator at iRAP, and I will be your moderator today. And just a few notes for you. Our webinar has between 70 and 90 minutes. We will have time for questions. However, all attendees are muted. You are welcome to post your questions on our chat at any time during the presentation. You can see the chat field on your control panel. So please post your questions there. Our presenters will make a few stops during the presentation, and I will read your questions to them and they will answer for us. If you haven't registered on Schoology yet, please do. There you'll find other resources. We'll also post the video of this presentation and the presentation file tomorrow. So make your student account on www.schoology.com and click on Join a Course. Use this access code to join the course. You should have received these instructions on the email registration, but I will send again tomorrow. So we have 5 presenters on this session. 3 of our presenters are from the Global Road Safety Facility, the World Bank. We have Dipan Bose, the Senior Transport Specialist. Hi, Dipan. Where are you talking from today?
Good morning, everybody. This is Dipan Bose, and I'm based in Washington, D.C.
Thank you and welcome. And we have Alina Burlaco. She's the transport specialist. Hi, Alina. Where are you talking from today?
Good morning, good afternoon, everyone. Many thanks to all participants for joining us and wish you a warm welcome from Singapore.
Thank you. And we have Krishna, the Senior Road Safety Consultant. Hi, Krishna. Where are you talking from today?
Hi, Ali. Hi, everyone. Welcome to this webinar. I am Krishnan Srinivasan, speaking from Hyderabad, India.
Thank you. And we have 2 presenters from iRAP, Luke Rogers, the Global Operations Manager. Hi, Luke. Where are you talking from today?
Hi, Ali. Hello, everybody. Yes, I'm Luke Rogers, and I'm based in Brisbane, Australia.
Welcome. And we have Jigesh Bravzar, the Technical Manager for IndiaRAP. Hi, Jigesh. Where are you talking from today?
Hi, everyone. Welcome to this webinar. I am based in Delhi, but presently I'm in Ahmedabad. So let me also give an overview of this webinar series. So today is the first session of these 4 sessions, and the World Bank team today will provide information about the Bloomberg Philanthropies Initiative for Global Road Safety. We call it BIGRS, BIGRS in short, and also World Bank's perspective on road safety. Later, Luke Rogers will talk about the International Road Assessment Program's background and the UN Global Road Safety Targets. And at the end, I'll talk about some case studies and examples of iRAP assessments conducted in India. The second session on Thursday will focus on the process, how star ratings and safer road investment plan are prepared, and my colleague Alvin will run a live session showing the star rating demonstrator. In the third session on next Tuesday, I and Alvin will take you to VIDA, the iRAP online software where the data is processed and results are stored. We will show how to access results and use them for implementation. This session will be helpful for road authorities to make optimum use of the available result. And the last session of this series on 11th June will focus on the overall process, how the road authorities can conduct safety assessments. Information will be provided on topics such as how to procure iRAP services, who can deliver high quality iRAP projects. The consultants and road safety engineers will get information on how to be an iRAP accredited supplier and participate in any such project. So that was an overview about this webinar series. Now over to you, Ellie.
Thank you, Jigesh. And I will hand over to Dipan to start the presentation today. So the mic is yours, Dipan.
Thank you, Ali. So let me begin by talking about the 4 topics that we are going to cover in today's webinar session. First, we will go over a brief overview of the Bloomberg Philanthropies Initiative for Global Road Safety, or BIGRS. So this is the main donor-funded initiative which has supported most of the iRAP work, which we'll be discussing in this webinar. Secondly, we will be going into road safety activities that have been done in India, and particularly the ones done in partnership with iRAP. Third, there will be an introduction to iRAP. Today, we may only have time to give some basic overview of the iRAP methodology, but this will be covered in much detail in the remaining 3 days of the webinar. And lastly, to give a flavor of the implementation work, we will take you through some of the practical examples of iRAP safety assessments being implemented in India. So in this webinar, we hope to cover some of the key aspects from the Bloomberg initiative. Nevertheless, we'll be more than happy to continue this discussion beyond the course of the webinar. Let me thank you on behalf of the World Bank team for enrolling and joining today. Hope you enjoy the next 2 weeks and look forward to the discussion. Now, to start the presentation, let me pass the virtual floor to my colleague, Alina.
Thank you so much, Dipan. Before we go into the first presentation, I just want to say that as a road engineer, it is very sad to admit that road transport generates 97% of fatalities from all modes of transport, being the first leading cause of lives lost for young people. And even if you have probably heard this before, I still want to highlight the fact that the deaths from road traffic injuries are equivalent to about 7 big planes crashing each day. And unfortunately, you are more likely to be killed driving on your way to the airport than on a flight. At the same time, low and middle income countries suffer 93% of the road crash deaths and injuries. With an average rate of 27.5 deaths per 100,000 population, the risk of a road traffic death is more than 3 times higher in low-income countries comparing to high-income countries. These deaths and injuries increase poverty and reduce shared prosperity by driving families into economic hardship, and in many cases poverty when the family's primary income earner is killed or suffers disability. In addition, crash deaths and injuries drain human capital and create costs which have been shown to significantly limit the economic growth of low and middle income countries. In addition, I'm not sure how many of you are aware that the first crash victim ever recorded was actually 150 years ago in the United Kingdom. Since then, according to rough calculations, at least 60 million people lost their lives in traffic crashes and hundreds of millions were injured over time. Believe it or not, but these figures are very similar to those of casualties from the Second World War, which is considered the deadliest military conflict in history. The magnitude of this crisis is enormous, and I will hand it over to Dipan to provide you with more information on this.
Thanks, Alina. So besides the burden on health, road injuries also have a significant socio-economic impact to the society. In 2017, World Bank produced a report with Bloomberg funding titled The High Toll of Traffic Injuries. You can find the link on the slide over here. The key finding that we found as part of the analysis was that by reducing road traffic injuries in half it could translate to an additional 7% to 22% of GDP per capita income growth over a period of 24 years. India, which was one of the 5 countries analyzed in this study, showed the GDP per capita growth could be as high as 14%. Now, these are not small numbers and shows evidence that there is a significant economic loss associated with every year of inaction that low and middle income countries fail to move beyond their status quo performance. So while road traffic injuries may constitute only 2 to 3% of all causes of death, the long-term impact on economic growth for the developing countries is quite significant. In a country like India, where there are several competing development priorities, including the ongoing economic fallout from COVID-19, we simply cannot afford the cost of inaction due to preventable causes like road injuries. Towards this cause, Bloomberg Philanthropies have been working in the area of road injury since 2009 and has dedicated more than $260 million over the last 12 years to implement life-saving interventions in low and middle income countries and cities. So starting in 2010, Bloomberg launched the Road Safety in 10 Countries project, a 5-year project, which was then followed by the BIGRS Phase 1, another 5-year project which started in 2015 and ended last year in 2019. Together, the initiative has estimated to save 312,000 lives and prevented up to 11.5 million injuries. More recently, in 2020, the BIGRS Phase 2 was launched earlier this year at the Stockholm Ministerial Conference, committing $240 million with aims to save 600,000 lives and prevent up to 22 million injuries in low and middle income countries. The World Bank Global Road Safety Facility, or GRSF, is one of the technical partners to the BIGRS initiative. Since 2010, World Bank has been collaborating with iRAP to implement the interventions from the Bloomberg program. You may find more about the BIGRS and GRSF by following the links that are there on the screen. This initiative works with leading road safety organizations to implement road safety activities and coordinate with in-country government and non-governmental stakeholders. As you can imagine, it is a multi-sectoral approach, meaning it includes efforts on infrastructure, policy, enforcement, road user behavior, vehicle safety, among others. So what you see in the map are the 15 countries that are part of this new BIGRS Phase 2 program. This includes Argentina, Bangladesh, Brazil, China, Colombia, Ecuador, Ethiopia, Ghana, India, Malaysia, Mexico, Philippines, Tanzania, Uganda, Vietnam. Now, among these 15 countries, there are 30 cities which have been selected as part of this BIGRS Phase 2 initiative, where the partners will be working. In India, the initiative will continue its work in Mumbai, and additionally, work will also be done in New Delhi and Bengaluru in the new phase. Now, for the World Bank, the activities funded under the Bloomberg initiative are very critical. In the 5 years of the previous phase, the BIGRS Phase 1, Bloomberg grant activities influenced 24 World Bank finance projects or advisory services, which had a total financing value of almost $8 billion. So you can imagine these activities have enormous potential to leverage the much needed public sector funds for investing in road safety. And beyond investments, we have also seen some dramatic on-ground transformation of civil works based on the technical advisory provided by iRAP in several of our World Bank projects. We will be seeing a lot of these examples during the course of the webinar. So you can find more about these projects on the World Bank side, as well as the iRAP reports from the iRAP side. I will end my presentation here and pass it over to Alina.
Thank you, Deepan. I would also like to highlight that building knowledge in road infrastructure safety and the expertise to sustain iRAP assessments in the longer term has been a key focus of the Bloomberg program. Overall, more than 10,000 people from government agencies, partner organizations, institutes, the private sector, and non-governmental organizations have participated in training, workshops, and presentations on road safety engineering, iRAP, and road safety data since 2015, including the popular online training courses that iRAP introduced at the end of 2018. Since adjustments were made to the iRAP accreditation scheme in 2018, which was a very important milestone, over 100 practitioners from 26 countries have obtained, and another 120 practitioners are in the process of obtaining iRAP accreditation. We have also engaged numerous local organizations and individuals to lead delivery of activities, and through this practical experience, they have now developed capability to deliver assessments and training in the future. In fact, more than half of the GRSF and iRAP budget from the Bloomberg program was invested in such organizations and people. The organizations include, for example, LabTrans at the Federal University of Santa Catarina, which is the Brazil RAP Center of Excellence, Chulalongkorn University in Thailand as the Thai RAP Center of Excellence, Research Institute of Highway in China as the China RAP Center of Excellence, and the Asian Institute of Transport Development in India hosting IndiaRAP, and the list could continue. Each of these organizations and people have now the capability to continue to support cities and countries, and this is how actually we prepared this webinar in strong collaboration with the IndiaRAP team. And apart from the direct impact of the activities on the BIGRS project roads in cities and countries, the capacity building efforts have also helped to encourage and bolster other local safety initiatives. The most notable is China, where the China RAP team has played a central role in the National Highway Safety to Cherish Life program, which implemented engineering safety improvements on 300,000 kilometers of roads worth approximately $5.1 billion during 2016 and 2018, making extensive use of the iRAP methodology. The China RAP team also drew on iRAP expertise and content to deliver training to more than 4,000 local engineers. Another example is in Thailand, where the Department of Rural Roads has made use of a light edition of the iRAP method to assess around 40,000 kilometers of roads and has begun implementation of affordable safety countermeasures across the network. Similar examples will be presented from India, led by the IndiaRAP team, which will be shown in this webinar series. So I will conclude here my presentation, and I will let my colleague Krishnan to provide you with an overview on the road safety engagement in India from the World Bank perspective.
Thank you, Alina. Good morning again, everyone, and namaste to all the people from India as well. As Alina mentioned, I will speak about World Bank's perspective and what World Bank has done and why. So I'll start off my presentation with this structure: why road safety is important for the bank, what has been the bank's role in road safety efforts in India, and how have some of these been applied and are being applied on some projects. So as Alina mentioned, and Deepan also mentioned in terms of why road safety is important to everybody, especially in Asia, in South Asia, it's a very unique challenge because even though South Asia accounts has only 10% of the world's vehicle fleet, it actually accounts for 25% of the global fatalities. So as Deepan mentioned again, huge investments are required if you actually address this problem and try to reduce your fatalities by half, which has been the goal both last decade and this decade going forward. Then you would actually generate an amount that is significant in terms of GDP. For India, this would mean out of the $118 billion that you see, a significant amount would be for India, maybe about $110 billion, but that would actually give you much more gains over the next 10 years. Again, going to why, I will not dwell too much on it, except to say that the most, like Alina also mentioned, the people that are getting killed are the young. 15 to 35, in fact, is the age group in India, where about almost, I think it's about 75% of the people killed are in that age group. Plus, you see that the people who are getting killed are the people, not people in the cars. They are not car occupants. Mostly in LMICs, including India, these are people who are cyclists, pedestrians, or motorcyclists who are the vulnerable road users. If you can, so that is very evident from the graph. That's the target. The target is to reduce the fatalities of the vulnerable road users. You can see also that I don't need to mention, but in Bangalore, the impact of a road death has been in terms of income decrease, in terms of productivity decrease, and people falling into distress and having to take financial loans. So next, please. What have been some of the activities in India? So World Bank activities have actually been in all states, in several states, where the areas of engagement at several levels, national level, state level, and city level, where the engagement has been for governance, policy, capacity building, road improvement projects, as well as what Deepan mentioned in terms of a multi-sectoral approach on specific demonstration corridor projects. So the investments, as you can see, have been across actually the top 10 states that accounted for 75% of the total road fatalities in India in 2018, and across, as you can see, strategy and operations. And if you can see the amounts that have been spent in terms of investment, it's about almost $250 million in overall projects, with the breakup being 50 million on completed ones and about 200 million in ongoing or upcoming projects. And these investments have followed a systematic approach, incorporating all the elements of road safety system. So the whole philosophy is to follow to look at it as a system where you need to tackle safer roads, you need to look at safer vehicles, safer people, and safer speeds. So this is a very key slide that I would dwell a little bit on. The approach is very focused in terms of infrastructure, and the reason is, of the three elements that make up the road environment or the road safety system, which is infrastructure, users, and vehicles, the two big aspects that any agency or regulatory authority can control are actually infrastructure and vehicles. And I would posit that these actually help you discipline users. The user behavior is a function of your infrastructure and vehicles. So the whole point is to build infrastructure in such a way, to design it that the available behavior is actually the right behavior. So this is really key. And if infrastructure is designed in such a way, then enforcement can follow and enforce that behavior. So you can see that the problem in most LMICs is you're having 60 to 70% of the issues are because the infrastructure is not designed in a way which actually allows for the right behavior. And so it also is built in such a way that it does not take care of all the aspects, user aspects, in terms of for building infrastructure for all users. It is mostly catered towards motorists. So this is why the approach has been to have bulk of your investments in infrastructure. And this is also shown in research in several, especially in Australia, where you can find that if you just incorporate safety in your design. So safety is actually the first casualty of design all over the world. So safety has to be incorporated into design. The safety by design concept has to come into place in most of our countries. And you can see that if you just incorporate the required elements, you can save up to 50% of your fatalities and serious injuries by just incorporating these elements in design with little or no additional costs. And this would be correlated later on by Jigesh and Luke when they show you some assessments, iRAP assessments completed in India, which actually show that 60 to 70% of our roads are very low star rated or very of high risk to users. Also, the other thing is to important thing is to also incorporate speed into the design. And this is not done at all in a lot of our countries where we, so there's posted speed limits. Nobody is going to follow the posted speed limits, as you know, in India and other South Asian countries. So you need to incorporate speeds into your designs so that you force users to actually slow down. And the way the bank has gone about it is to start with a small corridor, typically called as a safe corridor demonstration project in several projects. And I will show you some examples later on. But the key is to look at a multi-sectoral approach, as Deepan mentioned at the very beginning, where the key is to get all the stakeholders to work together in a mission mode towards reducing road safety fatalities. You may also be aware that the Supreme Court has termed the road safety scenario in India as a national emergency, and that it needs to be tackled in a mission mode. And this is very much needed if we are to actually address this problem in a very effective way. So multi-sectoral interventions, next please. On high-risk, high-volume roads, I will not go much deeper into this slide, except to say that infrastructure improvements on all these corridors were actually done, using the iRAP to actually look at what were the countermeasures needed and to demonstrate effectiveness through these demonstration projects. In addition to some of these demonstration corridor projects, the bank has also helped in establishing road crash database management systems, like in Tamil Nadu, helping setting up the institutional mechanisms, for instance in Karnataka, and also help providing support for the road safety authorities in Kerala and Gujarat. So next I will show you some examples of what has been good, what has been done well. You can see in Kerala how some of this is actually an 80-kilometer long stretch with 1 fatality per kilometer per year. And here a combination of iRAP assessments, proactive assessments combined with road safety audits at certain locations and public consultations were taken to transform this 2-lane highway with all the features that you see on the screen, with gateway treatments at schools and pedestrian facilities. And this is an example of actually building in the infrastructure to make sure that people, you can see some people actually, the motorcyclists in the last photograph actually using that, to use that lane to actually, so that you can prevent some of the motorcyclist crashes as well. So in some places, if you just put on a road marking, it has been found that people actually follow your marking. So people tend to follow if you actually put in the infrastructure in place. Next. Similarly, Gujarat, there's a very complex kind of rotary that you see on the screen. And again, through design, this is where I want to talk to you about safety by design. If we go to the next slide, so you saw what it was and what it could be. And this is actually being implemented now on Gujarat State Highway Project. This is a very small stretch, about 10 kilometers, but you can see that it has a lot of, basically activities happening along, and this particular rotary was designed after doing the risk assessment through iRAP. Similarly, Next, and Karnataka is the one that I will close with, where we have had a success story, which is actually now being studied all over, where the government actually, the project document had a 3-star rating as a condition or as a target to achieve. And some of the pictures of what the transformations happened, we would be, and again, this was a 60-kilometer long corridor, which had 3 crashes per kilometer and 1 fatality per kilometer annually. You can see some of the pictures where, again, using some of the design improvements, you could actually put in better facilities, traffic calming, better truck parking facilities, which is a big issue in India, where trucks parked on the highway, people rear end into them. So these have helped. Next, apart from engineering, the important thing to notice here is you have to combine. So this is where the multi-sectoral approach comes in, that you have to combine engineering and enforcement. So this was done through highly visible highway patrol to deter risky user behaviors. As you know, in India, you may be aware, 67% of the fatalities are attributed to speeding. So you need physical as well as enforcement measures to actually deter people from speeding, along with training and capacity building support. So what was the result of all this, all these actions? The results were much better than what the SDG goal is of 50%. In fact, more than 50% reduction in fatalities and injuries and crashes between 2015 and 2018, when the project finally ended in 2018. You can see the results. And this is a small 60-kilometer corridor, but if you want to actually scale this up, the bank strategy has been that if you want to scale it up to a higher level, then you could actually build a standalone project. And the bank's strategy has also evolved from doing only infrastructure improvements, as you can see from the short term, to going to area-wide projects, which we are doing now in Tamil Nadu, and now to go for a standalone project. For instance, something like a 140-kilometer corridor in Andhra took about $5 million. So you need to spend about 500 million maybe to make your network safe for everybody. Some of the lessons from these projects have been, next please, Jigesh. So some of the lessons have been that I will not belabor this too much, but except to say there are 4 important aspects. One is multi-sectoral treatments, being proactive and combining proactive assessments with reactive crash-based assessments of your network, and then going to network level assessments rather than sticking to black spot and localized improvements. And also the key is, in the second point, consistent implementation of layouts and treatments. It's very well known that in India, or in most countries, a speed hump is not the same everywhere. So that is vital to preclude or avoid giving surprises to users. And finally, I will stop with this slide, and this will be a nice segue for Luke to talk to you in detail about what the iRAP methodology is. But what I will just conclude by saying is that iRAP is the first step, and a very important first step, in actually having a proactive assessment of your road network, especially in places where you do not have enough crash data to go on. And so iRAP is not the end all of your road safety work. And it does not actually eliminate audits. It does not replace audits. It actually supplements audit. So you would still need to do audits. Crash data can still be used to find your high risk locations, and you would need requisite standards to actually build in some of the countermeasures, and all these would go into the design and then implementation. And then maybe if you follow this process, it might be a way of doing a systematic crash risk assessment and addressing your road safety or in your corridor, province, city, state, or country. Thank you, and we'll be happy to take any questions.
Thank you, Dipan. We have a few questions here. A few people are also asking about how they can be benefit with the project. Some are from engineering organizations, others from education organizations. So how can they join this project?
Thank you, Ale. If I could reply on this, I think it depends a lot on the country. So Dipan was showing a bit earlier the map with the 15 countries that were selected by the donor. As we mentioned, this is a donor-funded project, the donor being Bloomberg Philanthropies. And Bloomberg Philanthropies is the one that decides where to work based on a variety of factors, including burden of road traffic injuries, population, commitment by government, and so on. So on this specific project, it's not up to us. And if those that want to get involved are within these 15 countries, I would tell them to please reach out, and we're happy, even if it's on education or engineering, we're happy to assist and put you in contact with the partners from this program, the partners that are working on specific topics. And if we are talking about people asking this question but are outside of the 15 countries, that is not for me to decide, and it's as I mentioned, Bloomberg Philanthropies is the one taking the decisions on the countries. And but of course, we still have iRAP and with the GRSF team, so please reach out and we'll be able to help you as much as possible.
Thank you, Alina. We have another question for Krishna. When looking at safety in designs, are you looking beyond just the people using it, but also those that will do the maintenance and operate the road network?
Yes, the road network has to be assessed every once in a while to see what your problems are. So even after you've designed the road, say using even after using iRAP, you would still find that there might be some things you might have missed. So for new roads, in fact, you would do a road safety audit, but for existing roads, iRAP would be a good way to go about it. And iRAP also actually can help you do the designs, which Luke will talk about. But the important thing is to consider it from all users' perspective. It is, and this is the issue, that I was mentioning, that people tend to, the first casualty of budget is to cut out the important road safety elements. Important elements like, and especially in our countries, a lot of these elements are done as afterthoughts. For instance, lane marking, road signs, narrowing of the roads, pedestrian refuge islands, pedestrian footpaths. These are important. And if you do not have these elements in place, and if you just think that the building the road is only the bitumen and the nice pavement, then you're going to have problems, because the more you improve that quality of the road, the surface quality, you're going to have more problems, because the people will tend to speed up. So unless you have other measures to calm traffic and to have people not doing risky behaviors, you're not going to be able to solve the problem.
Thank you. Just one more question, and I think probably in the next presentations we'll answer that. What kind of data used to estimate the infrastructure participating in crash statistics? Ahmed is also saying that in many countries it's always stated that the users are the responsible and not the infrastructure.
Yes, Ali. I think this is a very common issue that I'm seeing in many countries. If you look at police records, you will always see that human factor is to blame in 90+% of road crashes. But if you look in deaths, you will see that the way that a road is the layout of a road can actually contribute and transform maybe a serious crash into a fatal crash. So I think it depends from the perspective that you're looking to the crash, because the police it's their job to find the one to who is responsible for the crash. But us as road engineers, we need to see what we can do to prevent this. And I think you're right, because Luke will be presenting a lot. He will showcase the four the star ratings from iRAP and the attributes that we are looking at the road when doing an iRAP assessment. And I think this links very well with the question, and I think basically the next presentation will actually respond this question in detail.
Thank you. And we will move to the next presenter, and we have one question maybe for you then, Luke, where you were doing your presentation. It's about if iRAP methodology is only for urban or rural or highways, what kind of roads we implement our methodology. And another person is asking about iRAP accreditation. So we will talk more about iRAP accreditation on the last session. Anyone can apply. There is a process, and I will present how the process works as well. And now, Luke, I will hand over to you.
Yes, thank you, Ali. And yes, I do cover where iRAP assessments can be undertaken. So yes, you'll learn about that in one moment. So hello, my name is Luke Rogers. I work with the International Road Assessment Programme, or iRAP, and I manage our strategic projects delivery team. I've only got about 10 minutes today to give you a very brief introduction to iRAP, but you'll certainly get an opportunity to learn a bit more about what we do in the following sessions. So we're a registered charity dedicated to saving lives through safer roads, and are currently active in more than 100 countries around the world. We work with governments and non-government organisations to assess road user risk and promote safe road design. We inspect high-risk roads and develop star ratings and safer road investment plans. We provide training, technology, and support that builds and sustains national, regional, and local capability. And we track performance so that funding agencies can assess the benefits of their investments. The iRAP model is overseen and governed by a global technical committee that consists of the leading road research agencies around the world, including TRL in the UK, ARRB in Australia, MIROS in Malaysia, and several others. iRAP is the umbrella organisation for several self-governing programmes such as EuroRAP, OSRAP, ChinaRAP, and of course, IndiaRAP. We encourage countries to take the iRAP programme and implement them in a way that suits the local country's contexts and needs. So there are three key guiding principles in the iRAP philosophy that I think I need to explain early on. So firstly, that road fatalities are a huge public health issue. Crashes are the leading killer of young people worldwide, but they are largely avoidable. Secondly, that people do make mistakes, and good road design can help road users understand what to do and will forgive driver errors when they occur. It is not acceptable to design a road without the necessary safety features needed to protect the public that use them. And thirdly, that targeted interventions that improve new and existing roads make good financial sense. We can include relatively low cost and effective treatments that will save lives and will provide good economic returns. Another critical issue to be aware of is the role of speed in designing a safe road system. This chart shows the fatality risk for pedestrians and cyclists, for side impact collisions at intersections, for example, and also for head-on type crashes as speed increases. So for pedestrians, you can see that at a collision speed of 40 kilometers per hour, the fatality risk is around 30%. But if we increase the impact speed by just 10 kilometers per hour to 50 kilometers per hour, we can see that the risk of death increases to around 80%. And this is why many of our pedestrian areas have speed limits of 40 kilometers an hour or less. For side impact collisions at speeds of around 50 to 60 kilometers per hour, the fatality risk is relatively low at around 20%. But at 70 kilometers an hour, you have an 80% chance of being killed. And this is why we must be conscious of good intersection design at higher speeds. For frontal or head-on collisions, fatality risk increases greatly at speeds above 80 kilometers per hour. This is why we need to consider physical medians and divided roads in order to prevent head-on crashes on higher speed road networks. We have partnered with some of the leading road safety organisations globally to develop the road assessment programme. One of our key programme donors is the FIA Foundation, who have supported our work around the world since the start. Development banks like the World Bank and the Global Road Safety Facility, the IDB and the ADB also support our work and use star ratings to measure the safety of new and existing roads. Star ratings are based on road inspection data. We have developed a model that we use to give roads a star rating for safety. We can generate star ratings for different road users, including vehicle occupants, motorcyclists, pedestrians, and bicyclists. 5-star roads are the safest, and 1-star roads are the most high risk. Star ratings have been used to measure risk on all types of roads in many different countries. Star ratings can be undertaken in urban and rural areas, on motorways and expressways, and on minor roads and city streets. We can use the star ratings methodology even where detailed crash data is limited. We applied the star rating model in all 10 cities and 5 countries under the recent Bloomberg Philanthropies Initiative for Global Road Safety. We completed approximately 2,700 carriageway kilometres of assessments of existing roads at the city level and 12,600 carriageway kilometres in the country programmes. We also assessed 1,500 carriageway kilometres of designs and upgrades in the cities and over 5,000 carriageway kilometres at the country level. We're hoping to do something similar in the new phase. So iRAP projects can provide a measure of the level of risk, but it is also useful to know what type of solutions could be introduced to improve the star rating and to improve safety. This is where the safer road investment plans can help. We will want to know, can we improve the safety of the road in an affordable way? What safety features can we include and how much would they cost? How effective would the upgrades be? And how many deaths and serious injuries could we prevent? These are all questions that can be answered in the Safer Road Investment Plan that the iRAP software generates. The plans are based on more than 90 proven road safety countermeasure options. It gives you suggestions about what could be built and where, and what would be the effect in terms of A, lifting the star rating, and B, how many lives might be saved over a period of time. Again, from the recent BIGRS projects, we estimated that if all the countermeasures identified are implemented, then almost 7,000 lives in the cities and more than 23,000 lives in the countries would be saved between 2020 and 2030. And if we take the designs that have already been prepared or where improvements have already been made on roads, about 1,200 lives in the cities and around 5,800 lives in the countries will be saved. It is important to mention here that these are estimated numbers of fatalities. If we were also to consider the impact on serious injuries, we would expect the numbers to be more than 10 times higher. We know that the model works because several studies have been conducted that compare the star ratings with actual crash data. This research shows that a person's risk of death or serious injury is approximately halved for each incremental improvement in the star rating. So we can see that risk reduces by around 50% when we improve a road from 1 star to 2 star. That risk is reduced again by around 50% when we improve a road from 2 star to 3 star, and so on. This shows that road assessment programs can be very effective in improving the safety of our roads. To address the global road safety crisis, UN member states have agreed on 12 global road safety performance targets to guide institutional action. Targets 3 and 4 are about safer road infrastructure. Target 3 states that by 2030, all new roads are to achieve technical standards for all road users that take into account road safety or meet a 3-star rating or better. Target 4 says that by 2030, more than 75% of travel on existing roads is on roads that meet technical standards for all road users that take into account road safety. So for India, this would mean an investment of approximately $91 billion over the next 10 years and would prevent over 83,000 deaths annually, with an economic benefit of $550 billion and a benefit to cost ratio of 6 to 1. Finally, we are really fortunate that now so many countries and organisations are adopting star rating targets. In the UK, for example, they have a target that 90% of travel on the strategic road network will be on 3-star or better roads by the end of this year, and that motorways will achieve a 4 or 5-star rating. New Zealand have a 4-star target for their roads of national significance, and the Netherlands aim to eliminate all high-risk 1 and 2-star roads by the end of 2020. The Asian Development Bank, the Millennium Challenge Corporation, and the World Bank have all adopted targets for new road projects that incorporate minimum star ratings. So, if you are involved in the design and management of new road projects, ensuring that they can achieve a minimum of 3 stars should be a real target that you are aware of and can work towards for a safer future on our roads.
Thank you, Luke. We have a few questions here, and many people are asking actually, how do we assess the improvements and how do we know if they are a result of the engineering improvement?
Yes, good question. So how do we know, how do we assess improvements? Well, that's a fairly straightforward and easy one. What we do is we can do an iRAP assessment or an IndiaRAP assessment either on the designs of the roads or even better post-construction. So once the road has been upgraded, we can do another iRAP assessment and get the results and compare the before and after star ratings. The change in star ratings will show the changes in the road engineering design features, because that's what an iRAP assessment does. So what we can say is that the improvements in engineering will be able to put a figure or a number of deaths and serious injuries that are likely to be reduced from those improvements. Obviously, crash data, if we collect it at a later date, that can also help us to show the benefits. But because the star ratings are based on road infrastructure, we can get an immediate measure of the benefits from the upgrades that have been implemented.
Okay, yeah, so there are many questions about data, how they can access the estimate of reduction of road fatalities, and if there is something happening in India to improve this data collection.
Yes, Jigesh, did you want to? I mean, the data that's in VIDA will be covered in another session, but perhaps Jigesh can talk about that and any other data that is available in India.
Yeah, so thanks, Luke. The question is on the data, how we assess the data. So the one way is to look at the iRAP assessment, where it estimates how many lives can be saved by doing a particular treatment. But also on the data collection, the crash data collection, Krishnan has mentioned the driver system, which World Bank is using under the Bloomberg Philanthropies program and also in many other countries. So that is the good way of doing a data collection using the technology and sharing the data with others. Maybe towards the end, Krishnan can throw some more light on the drivers. But from iRAP part, we have session 2 and 3 covering the process methodology, where we will show what type of data is required to be collected to generate star ratings and safer road investment plan. So I think the question will be fully answered in the next sessions on Thursday and next Tuesday.
Okay, so thank you, Luke. And then I will hand over to you, Jigesh. And I think in your presentation, you also answer a question from one attendee asking if how are you selecting the stretches of roads in India?
Okay, sure, I'll do. So I'll start with this map of India showing the roads assessed till date. So the iRAP assessment, it started for the first time in India. It was done in 2010. The assessment was conducted on a National Highway 1 connecting the capital city of Delhi with Panipat, you can see in the northern part of India. Since then, many of these states under World Bank support have been, as Krishnan mentioned, we have done these assessments. So these include states like Uttar Pradesh, Assam, Andhra Pradesh and Telangana, Tamil Nadu, Kerala, Karnataka, Gujarat and Rajasthan. Under the Bloomberg Initiative for Global Road Safety Program, safety assessments were conducted on about 200-kilometer urban road network in the Mumbai city, and also on the Delhi-Mumbai-Chennai sections of Golden Quadrilateral Highway, covering about 5,400-kilometer road length. We will see more details on these two later in this session. We have also conducted safety assessment of 2 public-private partnership roads, one in Tamil Nadu and one in Telangana, with Abertis, which is a toll road company. Recently, a team of Educational Institute IIT Kharagpur was trained to conduct iRAP safety assessments. The team prepared star ratings and safer road investment plan for about 1,400 kilometer state highways network in the state of West Bengal. All these iRAP safety assessment involve training and capacity building of local road engineers, consultants, and road design engineers involved in the project. To date, more than 18,000 kilometers of national highways and state highways have been assessed. On this road network, more than 85,000 deaths and severe injuries occur every year. As per the data we have collected, it comes as part of supporting data that we collect from either police sources or other sources. Now, by implementing the identified safety treatments, as Luke has shown in the Safer Road Investment Plan, it is possible to save over 50% of this number of deaths and injuries. The crash data over this road network shows 75% of fatalities occur among the vulnerable road users. You can see here in the pie chart, the motorcyclist, pedestrian, and bicyclist, that combines about 75%. And this shows how unsafe is the road infrastructure for them. Now, in the state of Uttar Pradesh, under the State Road Core Network Development Program, about 2,000 kilometer network was assessed. The road designs for priority roads which were to be improved of about 200 kilometer length. The designs were assessed and star ratings were prepared. The analysis helped to identify potential improvements in the safety by incorporating the more safety features in the design. The designs were modified to get better star rating, as shown here in this graph. You can see here. So this shows the baseline, that means the existing road before improvement, and this shows the 3-star or better road length if the designs are implemented. So this shows significant improvement in the safer road length if these designs are implemented. As per the estimate, we can prevent over 6,000 deaths and serious injuries if these designs are implemented. In the similar style, the assessments were conducted in other states that I have mentioned. Now, on the Golden Quadrilateral Highway, iRAP conducted safety assessment with GRSF and National Highway Authority of India. This national highway connects Delhi, the capital city, with Mumbai and another metro city, Chennai. These two sections of national highway are among the most strategic set of corridors in India in terms of linking major cities, ports, and industries. The safety assessment created invaluable database. For example, on the road curvatures with respect to the horizontal alignment, you can see here 78% of the curvatures where traffic flow is traveling at the speed of 80 km per hour or above, there are some hazardous roadside objects present, such as trees, signpost, or pole, or other hazardous objects. If you look at the intersections, there are 72% of intersections where traffic speed is 60 or above, but they do not have any safe intersection treatment, such as roundabout or protected turn lane or interchange or traffic signal. On an average on this corridor, there are about 2 intersections per kilometer of the road length and 5 property access. That means access from commercial or residential properties such as rest areas on the highway, fuel stations, etc. Now, this is a very high density of intersection, and it definitely increases the risk of intersection collision on such high-speed road. If we look at the roadside objects which are present in this pie chart, the maximum road length is covered by objects like tree or signpost or pole. There are also some safe treatments like the safety barrier, either metal or concrete, which is a good treatment which reduces the severity of a run-off crash. Interestingly, there are about 10% road length is covered by unprotected safety barrier end, which means there is a crash barrier, but the end is not protected. So if a vehicle hits this end of the barrier, the vehicle is going to, and the road user as well, going to get severe damage. Now we prepared the star rating analysis for this highway for 2 different speed limits. So when the road surveys were conducted, these posted speed limits were 80 km per hour. Later, the government notified actually increase the speed limit on 4-lane or 6-lane national highways to 100 km/h. In the graph here, you can see the orange, green, and yellow color, which is 3-star, 4-star, and 5-star. So that is the safer route length. About 70% of the length safer for vehicles at the speed limit. If we increase the speed limit data in the analysis, but the road infrastructure remains same, the safer road length reduces to under 50%. Similarly, for Mumbai-Chennai, 50% of the road length is safer at 80 km/h. If we increase the speed limit to 100, that safer road length reduces to under 40%. And this shows the negative impact of increasing speed limit without appropriate changes in the infrastructure. Now, strip plans like this were shared with the implementing authority so that they can do more detailed analysis and for it helps them for the implementation. A detailed strip plan such as this shown here, you can see in the first column the road changes are mentioned in the distance of every 100-meter road interval, and treatments listed here in the different columns. So for example, on the first 100-meter segment of this portion, you can see improving delineation is identified as an economical viable treatment that includes better road markings, traffic signs, etc. Providing roadside barrier, the crash barrier on driver side, which means on the right-hand side, and putting shoulder rumble strips. I'll show one more example of this. So this is the image taken from the road survey data of this particular road section of Pune to Satara in the state of Maharashtra. So here the road attributes, key road attributes are listed on the right hand side. The one in red color represents high risk. The one in the green color represents low risk. The operating speed is 90 km/h. The median, you can see here, it's narrow median and without any crash barrier. The line markings are not present, though you can see some edge line marking. You can also see some trucks parked on the left hand side. There are some hazardous objects such as trees and poles near the road edge. There are 3 lanes available for traffic in each direction, which is good or safe for high-speed roads such as this. The road alignment is straight. There is no intersection, but there are some access from commercial properties such as rest areas and fuel stations. As a result of this data, the road segment here gets 2-star rating for vehicle occupant and 1 star for motorcyclist. Now the Safe Road Investment Plan identified the economically viable treatment such as median barrier. So putting a crash barrier in the median will eliminate the risk of head-on collision between the 2 directions of traffic. Edge line marking, lane markings, and shoulder rumble strips. Passenger side crash barrier, that means on the left-hand side crash barrier, and parking improvements. So if we implement these treatments, the star rating improves to 5-star for vehicles and 3-star for motorcyclists. So this was an example how the Safer Road Investment Plan are helpful for the implementing authority and to decide which treatments are to be implemented. Now I'll take you to the State Highway 20, about which Krishnan also talked. So this is the Safer Corridor Demonstration Program in the state of Karnataka. The road designs were prepared and the target was to achieve 3-star rating for the maximum road length as possible. Now we conducted safety assessment of this road also after the construction, that is the post-construction assessment. During the project preparation, the star rating assessment was done before construction and during the design. The post-construction assessment revealed that maximum length of the road improved to 3-star or better. You can see here that this is the baseline existing road before improvement, and after improvement it achieved this much. So the length of the road, say 79% length of the road, gets 3-star or better. So significant improvement in the safer road length for all 4 vehicle groups or road user groups that brought the very good safety benefits, as Krishnan mentioned. Now that's a huge benefit to the road users and the community living around. The 50% reduction is really huge benefit. Safety improvements like this, for example, this is a 4-leg intersection on this road. So you can see post-construction image showing the bus lay-by, raised pedestrian crossing with a median refuge, and right turning lane for vehicles at the intersection. Treatments such as these improve the star rating. So here you can see before construction it was 1 star for pedestrian and bicyclist. It improved to 3 star for both of them. From 2 star to 3 star improvement for motorcyclist, and from 2 to 4 star for vehicle occupant. Another satellite image for a 3-leg intersection, it shows before improvement it was a skew angle intersection on a curvature, which makes it very dangerous or high risk for high-speed traffic. The improvement at this intersection included several treatments, including the traffic calming measures such as the yellow painted strips, the trapezoidal humps or the raised pedestrian crossings applied on both sides of the intersection. These treatments help to keep the traffic speed below 40 km/h in the intersection area. And it also helped to improve the star rating significantly. As you can see, all 4 road user groups get 3 star or better rating with this improvement. Now in the state of Gujarat, the State Highway 55 was improved, and this intersection shows some temporary treatment at the intersection, 4-leg intersection. It was improved to a very good, very well designed roundabout. And the star rating improves from 1 star to 3 star with this improvement. There are a few more examples in the Gujarat, the facilities for vulnerable road users. As you can see, raised pedestrian crossing, footpath with fence, and better delineation. The safety treatments such as these constructed in Gujarat and other states have actually helped to improve safety of the vulnerable road users. In Mumbai, about 200 kilometers of urban roads were star rated. One of the roads where there was a lot of focus by the BIGRS partners is LBS Marg. This is a 10-kilometer long major arterial road in the eastern suburbs. As per the past crash data, around 13 people were being killed on this road each year. Majority of the people killed are pedestrians, motorcyclists, or those in the auto rickshaw. The iRAP assessment showed that, for example, very little of the road had formal sidewalks, that is footpath, or effective pedestrian crossing facilities, despite the fact that pedestrian flows are very high. We made a series of suggestions for the road, and BIGRS partner WRI prepared road designs. The final designs included sidewalks with uniform width, parking space and bus stops, safer intersections, pedestrian crossing facilities, and traffic calming treatment. Overall, the road designs, which are now being built, will see the pedestrian star ratings dramatically improve. Most importantly, it was estimated that the designs will save more than 70 deaths and severe injuries every year, and that would be about 50% reduction from the current level. In addition to this, the iRAP assessments in Mumbai also cover some of the black spots where the identified treatments show significant reduction in crashes if is possible if these treatments are implemented. Now this is the summary of the star ratings in India. So the pie chart you can see here, the black and red color, it shows the high risk, 1 star and 2 star. So for pedestrian, about 83% of the travel happens on unsafe road infrastructure, that is 1 and 2 star. For motorcyclist, about 77%, and bicyclist, about 80% of travel happens on 1 and 2 star road infrastructure. You will see that for the vehicle occupants, the situation is slightly better. 56% of travel on 3 star or better roads, and that is probably, as Gretchen mentioned, we design the roads for vehicles and we forget often the vulnerable road users. Now the reason why most of the travel on high risk road sections are obvious. For example, 95% of road length where pedestrians are present, the traffic speed is more than 40, they do not have any formal footpath. Or over half of the pedestrian crossing where the crossing facility for pedestrian is there, but it is poorly maintained, not very well maintained. So the usage is also low. So all these results of the assessment which I have mentioned, these are stored, these are processed, stored in the iRAP software, which is available online at vida.irap.org. We have in session 3 more discussion. We'll show you how to access results, how to see results in session 3. So this is just a brief of that session. Now, if we go into the software, the star rating map looks like this. So you can see the road network assessed in Gujarat. It shows the color coding from green to black, but most of the roads it is showing black and red. So this is how the star rating map looks. If we go to the Safer Road Investment Plan, it looks like this in a tabular style. So these are the treatments identified over this road network. And if I click on any particular road treatment, for example, delineation and signing of intersection, it opens up a map showing locations where these treatments are identified for implementation, along with some more details. So these are the details required to help the implementing authority to further study, do ground verification, to see if the treatment is feasible. And these are the actually steps required for implementation. Now, this is a summary of iRAP assessments recommendation or identified treatment. So over 18,000 kilometer road network in India, that is potential to prevent 10 lakh, that is 1 million deaths and severe injuries over next 20 years period. Investment of 1 rupee will bring benefit of 4 rupees in terms of safety benefits. And this investment will also lead to achievement of the UN Target 4 of having more than 75% of travel on 3-star or better roads. That was the all summary from the IndiaRAP assessment for now, and we are open to any questions.
Thank you, Jigesh. We have one question asking about the effectiveness of this methodology of iRAP methodology for heterogeneous traffic, like what you have in India, and in the same level of question, there is one asking if the iRAP methodology is the same model throughout the world or it's calibrated for individual countries.
Okay, good questions. The first one on effectiveness, where we have heterogeneous traffic like India, on the same road we have pedestrians, motorcycle, bicycles, and other motorized vehicles. So as you have seen, the star rating is done separately for 4 road user groups, and that is the reason why. So if we go back to the history of iRAP, it started with star rating for only car occupants. And then when the World Bank asked iRAP to develop model for developing countries like Asian countries where we have heterogeneous situation, with the help of research done worldwide, the model was extended to cover these road users. So what happens, for example, as a pedestrian, if I'm trying to cross the road, the risk to me is from a motorcycle or a vehicle which is traveling on the road. So that captures the heterogeneous situation. There are also other road users present. For example, a motorcycle will be hit by another car or bus or truck. That's how the heterogeneous traffic conditions are captured. And we will cover more on this in the methodology in session 2 on Thursday. On the question on iRAP calibration, so again, we'll cover more in the methodology, but I'll answer shortly this question that each model is calibrated to suit the local condition. So when we do star rating and safer road investment plan, the investment plan is calibrated. So with the help of past crash data, we calibrate the model, and the investment plan is prepared with this calibration.
Okay,
yeah,
thank you.
Yeah, sorry, Ali. Can I just add there, Jigesh? Yeah, that's correct on the model localization. There are a number of different ways that we can localize the model. There is actually a fact sheet number 15 on the iRAP methodology series, and you'll show people where to find further information. I'm sure in the webinars to come. But yes, certainly there are a number of different ways that we can localize the model, as you said, with crash data, but also vehicle operating speeds, traffic volumes, motorcycle percentage, pedestrian and bicycle flows, countermeasure costs, value of life and serious injuries. There's lots of different ways that we have allowed for the localization of the model to suit certain different situations in different countries, or even regions within countries. So yeah, just thought I'd add that.
Yeah, thanks,
you.
Luke.
So there is one question about road design. It's observed that design has much contribution on road safety. So apart from the star rating program, do we also consider including post-design road safety audit in the program?
Yes, so in the Safer Corridor demonstration program in Karnataka, in the example, so after the construction was complete, we did again star rating of that road. So that is the post-construction assessment, and that showed significant improvement in the safer road length compared to the road before improvement. And that was also there is also correlation between the crash reduction, about 50% deaths reduced on that corridor. And there are a few other examples I have shown from Gujarat of the post-construction, which shows before construction it was 1 star, and after construction it was 3 star. So definitely similar to road safety audit after opening of the road, star ratings can be conducted after opening the new road.
Thank you. We received.
I just wanted to add, Ali, I just wanted to add here that is the way you ensure that the design is actually implemented on the ground. So if there are, if the design is recommending, some iRAP treatments, but those don't get incorporated into the actual construction, then that will be found out by your post-construction assessments.
Thank you. We've received many questions during the session. I just want to tell everyone that if we haven't responded to your question during the session, we will answer on Schoology. We'll write all the questions and our team will answer for you. And I think we can end the presentation and move. So today we saw a few important topics to start our webinar series. We saw how the Bloomberg Philanthropies Initiative for global road safety is working around the world to reduce the burden of road injuries and deaths. We also saw the road safety project in India in the World Bank perspective, who iRAP is and what we do, and the iRAP safety assessments in India. And as I said in the beginning of this session, we'll have more resources for you about this topic on Schoology. In each session, we'll have the pre-reading material. So here you can see the welcome chat. And we also have the presenters bio in the Meet Our Webinar Presenters. To access the presentation file and the video, just click on topic 1 folder. And there you see the video, the presentation file, and you have an assessment, an assignment for this session. It will be 10 questions about the topic. You also have the resource support resources for your consultation. And if we haven't responded, so here you can access the chat with the questions that we'll answer for you. But also if you want to share your experience and the projects that you have been working, please post on our chat. We'll make sure we have this in the next couple of days, your answers there. And as I said, We'll have two types of certificates for this webinar series. You receive from it's an automatic certificate from GoToWebinar for each session. So this is a standard template, but we'll also have a certificate for the entire course upon completion of all pre-reading materials and assignments on Schoology. So if you complete our whole course, you also receive a certificate in a couple of weeks after completion. We have 5 websites. You may find more information about iRAP. So Luke said about our fact sheets. You see a lot of detail of the background and how we developed the model and the methodology on the iRAP website. You can see all the evidence there. You also see more about our courses. We also have the Vaccine for Roads site. It has been updated recently and has many personal stories showing how road crash injuries affect real people in real lives. All these resources and information are free for you to use. So please make the most and enjoy. And we also have the Bloomberg and World Bank Global Road Safety Facility websites here. There you can find more information and the reports about these projects in their website. Our next session is on Thursday, 4th of June. It will be at the same time, 10:30 Mumbai time. We'll talk about the star ratings and safer roads investment plan. And once we are heading to the end of our session, but just I will ask a couple more minutes of your time. Once we finish this session, there will be a pop-up screen with a feedback form. So this is very important for us to improve our webinars, the way we deliver our training. So please take your time and answer a very quick evaluation form. And finally, thanks everyone for attending our first session of this BIGRS and IndiaRAP webinar series. Thanks to our presenters and to our sponsors. Thanks FIA Foundation for the long time support to iRAP. Thanks World Bank, Bloomberg Philanthropies and Global Road Safety Facility for the partnership and support of many of the iRAP projects. And also thanks to AITD and FedEx for supporting IndiaRAP. We thank everyone for attending the session, and we look forward to our next session on Thursday. Bye.
Bye all. Thanks for joining, and please join us on the next session on Thursday.